In my experience from treating thousands of patients suffering from complex chronic illness, many hundreds of those patients have been diagnosed with fibromyalgia. And with those patients with a fibromyalgia diagnosis, in many cases we run testing to look for presence of chronic infections, infections with microorganisms like Borrelia burgdorferi, which is the bacteria that causes Lyme disease. And we test for other infections too, other bacteria and viruses and things like that. And what I've found is that in many of those patients with a fibromyalgia diagnosis, they test positive for Borrelia burgdorferi, this Lyme disease causing bacteria. And granted, not every patient that we then subsequently treat for that infection necessarily sees a dramatic improvement in their fibromyalgia symptoms, but many of them do. And putting two and two together, it strongly suggests that at least for a subset of patients who have fibromyalgia as a diagnosis, that the Lyme disease causing bacteria is responsible for that, or is a big part of why they have that fibromyalgia issue in the first place. So in my experience, I think that folks who have a fibromyalgia diagnosis, if something hasn't better explained what's causing that fibromyalgia in the first place, it's really worth considering doing a test for Lyme disease.